Hi everyone, this is another video about MARCoNS. Just before jumping into the video, if you don't mind taking a quick minute to like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying in the video should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So somebody posted a question on one of my other videos, and I'm going to kind of summarize it down because we had a little bit of back and forth to suss out the nature of it, but I'll read parts of it anyways. So essentially the person is having these sinus issues and wondering what to expect from treatment for MARCoNS. Her clinician has indicated that treating MARCoNS could help to avoid the need for a certain type of surgery. She's having symptoms, and the ENT or two ENTs that she saw want to do this rhinoplasty to enlarge the nasal passage on the upper bridge that would help her sinuses, but she also has some tinnitus / ringing in the ear as well. And so I kind of asked for a little more clarification about like what exactly is going on with the sinuses. I mean, you get the tinnitus, but what's going on with the other symptoms? And so she's saying she doesn't cough or sneeze or sound nasally, but quote unquote, everything sits in my head. It's like nothing from the outside can get through the bridge of her nose, and nothing on the inside can get out. Stuffy nose, stuffy ears, so it sounds very unpleasant. And then there's the ringing in the ears as well. Doesn't have any related hearing deficiency. And let's see here. Okay, I think that's there. And so she says, I've started the MARCoNS treatment. If you're not sure what MARCoNS is, I've posted some other videos about that before, but MARCoNS is basically this really persistent infection of the sinuses by a certain type of staphylococcus bacteria. A lot of clinicians associate it with mold toxicity as a point of interest. So she started on the MARCoNS treatment with BEG spray. BEG spray is this kind of antimicrobial biofilm disrupting spray. It's prescription only. And so she used the spray. It quote unquote hurt for a few hours after treatment. She moved to Argentyn 23, which is this silver spray, a relatively mild silver spray. And there's no problem for the first little bit, but after 10 days, it caused lots of ear popping. So that's the story. So looking for some feedback. So again, can't give any treatment advice over social media, but I'll try to give some information that's useful in kind of a roundabout way. So I've had other patients where they have similar history. It's kind of like there's just this really impaired sinus drainage issue thing going on, and sometimes those folks have wound up going for rhinoplasty, other types of like some sinus surgery, and sometimes it's helpful and sometimes it doesn't really fix things. I mean, from my perspective, for my patients, depending on what their goals are, how severe the symptoms are, etc., what kind of timeline we have, is it urgent or not? In my opinion, again, depending on what the patient wants, it does make sense to me to try some non-surgical options first, because once you cut certain things away or remodel things, you can't easily go back, maybe can't go back. You take a gallbladder out, can't really put a new one back in. Nothing to do with the sinuses, of course, but just as an example, surgery can be pretty permanent in a lot of cases. So that does make sense. I've had patients where they the surgeries and this and that, and the symptoms don't get better, and then we start treating with anti-inflammatories, and like, oh good, my symptoms got better, but then sometimes there are side effects from the surgeries because their anatomy has been altered, and again, sometimes surgery works really well, so there's no one size fits all, but it does make sense to investigate whether there's a sort of a non-anatomical issue that might be contributing to things, especially if a person says, well, they've had these sinuses for their whole life, and if they only started developing symptoms at a certain point, so if a patient says like, oh, I'm 45 now, and I've had these symptoms the last 5 years, but the first 40 years of my life, it wasn't a problem. It's like, well, you've had the same sinuses the whole time. So, so that would be another factor to consider, whether it's been something that's kind of acquired over time. It may be that, sure, there's some anatomical differences, but there's also inflammation or biofilm growth or whatever it is that might be exacerbating or contributing to symptoms. Where it does get tricky is for folks who do have issues with sinus drainage or lack thereof, using nasal sprays can be really problematic. It sounds like the BEG spray was problematic, sounds like the silver kind of had this honeymoon period, and then it became somewhat problematic, potentially because it was just gradually, Argentyn 23, it's a fine product, but it's quite low potency. It's only 23 parts per million silver. The product that I like to use has 200 parts per million silver. It's called ACS 200, so quite a bit stronger, like about 10 times stronger. So it may have been taking just a bit more time to build up, whereas the BEG spray, the E in BEG is for EDTA, and that's a really strong phase 2 biofilm disruptor. So what I would throw out there is the person mentioned in her question that she's talked to her naturopathic doctor, or they've talked about some of my videos and things like that. So if I'm by part of the think tank by proxy, let's say, one thing to consider, to maybe mentioning to your clinician, is that sometimes working with nebulized treatments as opposed to nasal sprays can be something to consider. The thing with the nasal spray is that it's, of course, this big whoomph of fluid, going up into the, not big, but an appreciable amount of fluid getting sprayed up into the sinuses. And sometimes when we use a nebulizer, where essentially it's turning it into a very fine mist or vapor, it can be better tolerated. It can kind of more easily get around the different nooks and crannies of some anatomical blockages or tight spots, so to speak, and get to the final location more efficaciously. But when there are those drainage issues, sometimes we have to be really quite cautious and gentle. So if I was recommending some silver spray for my patient, and let's say I said, oh, spray this, this formula like 3 to 4 times a day. Well, if there were drainage issues, then I might be recommending them just to do it, say, once a day, like, use a lower potency. Maybe after a week or two, if everything's going okay, now let's try twice a day and just kind of gradually build it up. Because when we do break down biofilms, when we're killing off MARCoNS, we're killing off mold, whatever it is, fungus, yeast, whatever it is we're killing off in the sinuses, sometimes, and many times, there will be a transient period of increased inflammation, more nasal secretion, more secretions trying to come out. And if everything's trying to get through this little pinhole sized passageway, metaphorically speaking, then things can really backlog and have weird symptoms and pressure and discomfort and things like that. So that's the based on my experience up to this point, those are some of the thoughts that I'd be thinking about when I'm hearing a story like this. As far as what to expect, it just really kind of depends on how it goes. I hate to say it, but cases like this, which are a little, shall we say, like a little more atypical, it may be that getting rid of MARCoNS and or whatever else might be growing in there could be really, really helpful, or it might not be. Again, depending on the timeline, how things have gone, like when various symptoms started to develop, that would give, I think, a better prognostic indication of whether treating MARCoNS would be like really, really impactful or not. But MARCoNS and other things that grow in the sinuses can definitely cause a lot of inflammation, and as things get inflamed, if you think about say you whack your finger with a hammer by accident, it's like, oh, the tissue like really, really swells up. Well, because it's really inflamed. So if the tissues inside the sinuses are swelling up, well, that can functionally really reduce the size of the spaces that are in there. And so it can really interfere with drainage and whatnot. So anatomical these sort of restrictions coupled with increased inflammation from MARCoNS or mold or whatnot, it could lead to some major drainage issues. So thank you for the question. I hope that this was useful in some way, shape, or form. If anybody has any comments or questions about this topic or anything else, just post in the comment section below, and I will leave it there for now.